and good evening. I'm Melisa Idris. Welcome to Consider This. This is the show where we want you to consider and then reconsider what you know of the news of the day. Penang Island has successfully fulfilled the application to join the WHO's Global Network for Age-Friendly Cities and Communities. The island, however, is also grappling with issues of congestion, heritage pressures, tourism growth and livability challenges. So how will Penang Island City Council balance these competing demands while at the same time planning for an older population? Joining me on the show to discuss this further, I'm delighted to introduce Datuk Rajendran P, Anthony, who is the Mayor of City Council of Penang Island. Datuk Rajan, welcome to the show. It's good of you to join me. Thank you for making the trip from Penang. So let's, first of all, congratulations on successfully joining the WHO Global Network for Age-Friendly Cities and Communities. Having said that, I'm curious to know what that membership actually means. So now that you're part of this really great club, what does that actually mean for the everyday residents of Georgetown?
Yeah, actually the population in Penang consists of 8.4% aging population.
Okay.
Which means that more than 7% of our population is aging. At present, it is 8.4. When we registered with WHO, the Global Network for Cities, Age-Friendly Cities and Communities, we were at 7.7% population. And these 2 years, we have gone up 0.7%.
Oh, wow. So in 2023, when you first started this process, it was 7.7% aging population. Penang.
Yes.
Now it's 8.4.
Yes.
It's gone up.
Yes,
yeah.
yes.
Quickly.
So, yes. So, the WHO states that if you are 7% and above until 13% population, you are an aging community.
Okay.
And if you are from 14 to 19%, you are an aged community. And if the percentage increases and hits 20%, you are a super aged community. Like cities, certain cities like Tokyo and developed cities mainly are aged cities. Yeah.
Right. So for the residents of Georgetown, what has that meant? The fact that the city council is now part of the global network. When you want to be, you aspire to become an age-friendly city, how does it feel on the ground for the everyday citizen?
Okay. So, being part of this community, we want to promote healthy and active aging. But before we do that, we had registered with WHO to show our commitment. And based on this, we had to come up with, fulfill the guidelines and aspirations of WHO for us to actually be included as an age-friendly city. For this purpose, WHO had defined 8 domains, structured domains, which we have to follow and implement. And we had implemented immediately after we joining the global network. We embarked on this plan to come up with a strategic action plan. This strategic action plan is for becoming an age-friendly city. And based on the guide from WHO, we engaged with our local community, the local people, the public, because our 2030 vision, Penang 2030 vision by the Chief Minister of Penang states that we have to engage and we want to empower people in our decision making. So before we came up with the strategic action plan, we engaged with our people to see what they wanted out of this.
Okay.
And based on their feedback, we came up with this strategic action plan for a period of 3 to 5 years. But we will need to have more strategic plans later on. But for this initial period, we came up with this strategic plan for these 8 domains.
Right. So the 8 domains are everything from outdoor spaces and building, transportation, housing, social participation, social inclusion, civic participation, communication, and also community support and health services. So I really like that these are really strong domains. But a lot of what I see as part of what's being described as part of age-friendly cities, it seems, well, it looks like good urban planning, right? So it has the same kind of pillars as good urban planning. What sets it apart from being just good urban planning to being an age-friendly city? Is there anything different that the City Council is doing in terms of planning or budgeting?
So we have to, to become an aging city, actually, we have needed to hit the population. But what are the strategies? So we have to come up with policies, plans, programs and projects to actually attain this becoming an age-friendly city. So we have come up with a lot of initiatives and programs to fulfill these needs of the needs of the World Health Organization.
Any initiatives that stand out to you as, you know, you're particularly proud of, that the City Council is particularly proud of?
Actually, there are many.
Okay.
What we have done since we became, we registered ourselves in July 2023 till to date, we have done a lot. But our journey started 10-15 years ago.
Oh, really?
Yes, because we had come up with we wanted to be friendly. I mean, we wanted to create infrastructure which is friendly to all age groups, not only the aging, but the disabled, the children, and etc. So we started about 15 years ago, and we came up with a universal design initiative. That means whatever we created, it was friendly to all different groups of people, and it is according to the Malaysian Standard 1184. So we imposed this condition on new development. At the same time, we budgeted about a few million ringgit, usually in the range of 3 to 5 million, to implement projects to create universal design features along the walkways, along the public facilities, and etc. So we started 15 years ago, but having said that, coming to this stage now, we still have to do more. It's actually a long-term effort, progressive and continuous effort. But we are doing it. We are doing it, and not only about walkways or pavement. It is the public transport. It is housing and many others. All that which are in the domain, we are doing it.
Do you find that it is particularly more challenging for Penang Island? I mean, we all know that the challenges, the constraints that Penang Island faces in terms of, you know, congestion and it's built environment. There's not that many ways that you can kind of, you're not planning a city from scratch. Let's just say that. So are there challenges in particular for Penang Island in trying to make the city more age-friendly, in implementing some of these initiatives that you talked about, including public transport, including housing, when the roads are so narrow and congested already, and housing is from many, many decades ago?
It's a long-term effort. But what I want to say, if I were to zoom in on certain features, certain aspects of Penang, I mean, we know that transportation is quite congested, but we are coming up with measures. The LRT system, the federal government is kind enough to implement the first LRT line, the Mutiara line in Penang. That would, of course, help. And we are creating a lot of one-way streets. We are widening the roads, but the congestion is still there. We need to do more. What we have doing now is we have coming out with a study to see whether we need to actually restrict vehicles, and what are the measures, many other measures, apart from creating efficient public transport system. What are the other measures we should do? Of course, housing is one part of the whole picture. We in Penang, in City Council of Penang, we have 1,555 housing units for the B40. So we allocate this only for the B40 group at a subsidized rental rate. So this helps out a lot. And more than 50% of these units house aging people. So they stay with the family or stay alone, and we give priority to this group of people, so that we can improve the condition.
Wow.
Yeah.
So 50% of the B40 population that stay in these low-cost housing are elderly, are aging.
Yeah.
Oh, so it's imperative that you know, that's really very crucial that you get the housing correct for more age-friendly housing.
Yes, yes.
Let's focus on mobility, traffic, for instance. In terms of mobility, when you talk about, you know, having the LRT, having maybe a study to restrict traffic, maybe one-way roads, I do wonder, all of that is wonderful for making the city more age-friendly, but do you have to navigate short-term trade-offs? Not everyone will be happy with the idea of making Georgetown more accessible or more walkable. There will be people, businesses maybe, who will be affected. So how do you balance those trade-offs?
Of course, I mean, it's not only about traffic, it's also creating an environment where people can access, I mean, all parts of Penang, making it barrier-free and etc. And now there's another issue, which is, you know, heat island effect, where people walk along the street, they feel the heat because the heat is coming from the top, from the building, from the ground. So we are trying to resolve all this actually by coming up with a project called Penang Nature-Based Climate Adaptation Program, which is actually funded by UN Habitat and also MBPP, City Council of Penang Island. We are funding.
And older people are more affected by climate change, by the climate crisis, for sure.
Yes, correct. Yes, yes. So we are coming up with more street line trees, streets with trees along the road, tree-lined streets, and permeable walkways. And then we have digital boards to indicate to people what is the weather like, the temperature, the humidity, the air quality, and
so
etc.
they can take precautions, right? If it's a hot day, you know, get some sunshade or something.
But in terms of public transportation, we know that public transportation is actually the problem solver when it comes to congestion.
Right.
So in Penang, public transport, public bus service is provided free throughout Penang actually. And then in addition, the City Council of Penang Island provides free shuttle service within Georgetown. And recently we approved another line, free shuttle service from Georgetown to the hospitals. So we are actually trying to encourage people to use public transport to actually relieve some of the congestion within the city centre.
So this will allow for older persons to have health service access through public
This
shuttles.
also involves the ageing society.
Okay. Well, so all of these initiatives, everything from, you know, permeable walkway and having these shuttles, was this already part of the plan from the beginning? You talked about how, you know, all of this began 15 years ago. But were there things that were there lessons that you learnt by watching other states or other countries who had implemented age-friendly initiatives that on the, you know, the global network of age-friendly cities and communities? Did you look at them and search for lessons?
Yeah, of course. Yeah. I mean, housing is one of the issues we will face, and also health services. Because I told you just now, the aging population was 7.7% of the population when we started, and now it is already 8.4%, and it's growing. The figure is growing. We expect to be an aged city, that is 14% of the population aged above 65 years. That we expect, it is projected in 2040.
Oh, wow.
We will hit that mark. So we have to get prepared from now on. Housing is one of the issues. As people, the population increases, the care services, the old folks home, the health services has to improve. That's why we want to promote active and healthy aging, so that people are productive even in their twilight years. They are aware that they need to keep themselves healthy. and we will do the health screening and provide all the services. We create the programs and also the education to make them more age healthily and actively.
I mean, and that's a great point, because when you think about age friendliness, it's not just the physical, right? It's not just about taking care of mobility and in the walkways and all of that. It's also about addressing social inclusion and digital literacy and community engagement. Is MPPP looking at that?
Yeah, we're looking at everything.
Okay.
Digital literacy is something we have town hall sessions to teach them how to use phones, handphones. Some of them, the aging group, they have difficulty in, not so tech savvy as the younger generation. And also scams, we tell them how to avoid scams and so on. So it's all part of, this creating this awareness and education to become an aged citizen.
Has that changed the nature of the portfolio for the City Council of Penang? Did you have to previously, before this, have to worry about digital literacy of the population? Because you think of city councils and you think of all the local government services, right? That keeps your day-to-day running. You rarely think about the social fabric, what keeps our society together, particularly the marginalized, older people, the people with disabilities and the like.
Actually, we have to make them part of the community, make them inclusive in everything we do, economy, social, civic participation, cultural, and spiritual even. They have to be involved in all, because we don't want to leave them out. Because most of the time, the aging people are left out of all this, In fact, when they retire, most of them, some of them, the savings are gone. So we want to also ask them, educate them to save.
Financial literacy.
In their twilight years, they may need it. Most likely they will need it. And also health insurance. All these must come in so that they are able to take care of themselves when they are in this group.
Have you had feedback from the community when you go and speak to older adults in the community? What kind of feedback have you received from residents so far?
I think the feedback is quite positive. Okay. In fact, 80% support our initiative because we do engagement all the time. Because the Penang 2030 vision talks about empowerment. And we do public surveys, we have focus group discussions, we go to these homes where they are living and we get feedback from them. Okay. But not only them, it involves the whole range of community from the younger generation to the aging group. Okay. So the feedback is very positive when it comes to age-friendly city initiatives. Okay. Yes.
Any areas that they think could be improved?
Yeah, there are a lot of things to improve actually. It is a progressive initiative, right? The progressive measures we are taking. It takes a long time to actually become truly age-friendly. But I can say that our financial, what we receive from our taxes is limited. Okay. And our resources are also limited. But we are doing things progressively, continuously. Small it may be, but one day it will fulfill people's requirement. Yes.
That's a really interesting point because when you think about many of the services that matter to seniors, right? You think about health, public housing, public transport. All of that sits either with the state or federal agencies, right? How has the coordination been? When you think about has it been easy to coordinate all the different moving parts of wanting to make a city age-friendly?
We have a state executive councillor, Yang Berhormat Lim Swee Kim, who's actually looking seriously into all this. So we are happy that we can work with the state government. But it's not only the state government, it is also the federal government.
That's right.
In state level and federal level is the ministry. Women, Family, Community Development Ministry, and also the Social Welfare Department. All these people, and also the health services, very important that they come together. And now we are actually engaging them also to actually do health screenings, and also go to the community themselves and check on their health, and probably provide medical care after that. So all this we are doing, not alone, but with the help of other departments and agencies.
So at the start of the conversation, you said that you started 15 years ago, right? To see the progress. You had to start 15 years ago. You have until 2040 before Penang Island becomes an aged city. So in the 15 years, next 15 years, what's next then for Penang Island City Council? I'm wondering whether there will be an opportunity to make Penang State not just an age-friendly city, but an age-friendly state even. Is Brang Prai going to join into the efforts to make it age-friendly?
They are being included now.
Okay.
I mean, of course, we started first. They are also doing. I mean, they are already registered and they are coming up with their own policies and plans and strategies to be an aging society. So, I just want to talk about some of the initiatives. Hopefully, you can allow me that we have done. We actually, the City Council of Penang Island, one of our premises, a bungalow, we have converted it into for the community services, for the age-friendly community services and their activities. So we are providing them with a very low rental. In fact, we are even subsidizing the rental to make it free. And we have a call center within these premises, manned by themselves. This call center where they can call out to the people in need. And we have provided a mobility van with a lift for a ramp and lift for wheelchair users. So, and the second van just arrived. So we are providing this service so that we can engage with this, communicate with these people and provide them the service directly. Because some of them just can't get out of their bed or they can't leave their homes. And we are providing these services. Some of them I even die on their beds and people do not know about it. So this is how we want to connect with these people and make this program available to them. I mean, to the hospital. Some of them can't move to the hospital by themselves. Right. So these services will.
So they have a number to call to ask for help?
Yes, the call center.
Okay.
Yes, yeah.
All right.
And it's manned by the aging people, so they know how to communicate with them, and they may probably know the problems they are facing.
Right. So can I ask you what powers or what resources is still needed for the City Council, for the Penang Island City Council, to be able to build on this momentum? You talked about how you have constraints. There's only so much tax that you collect from your residents. What more would you need to make sure that you achieve what you want to achieve?
We want the private sector to be more involved.
In what way?
Like one example I can tell you, I mean, we realize that the aging group needs employment, and the City Council of Penang Island, we have engaged 10 of them, but we have a long list. Actually, when we opened up, there were a lot of people applying, but we selected the first 10. They are doing urban farming, office jobs, cleanliness works, and many other things, even clerical works they are doing to help us. This employment part is part of creating an inclusive society for these aging people. So we have done that, and now we have engaged with the Hoteliers Association. They have also employed some aging people. We just want more private sector to be involved. Now we are going to have discussion with the manufacturing industry to see how they can actually employ some of them. Because these aging people, some of them are very mentally alert, they are intelligent, and they are physically active. So we need to give them a chance. Because when they lose, there must be self-sustenance. If not, the dignity, the respect and dignity we want them to have for lifelong.
Yeah,
Yes,
be part of the community. I'm sure they have so much more to give still, right?
Yeah.
Well, Dr. Rajan, it's been a pleasure talking to you. Thank you so much for telling us about what's happening in Penang Island now.
Thank you so much.
That's all the time we have for you on this episode of Consider This. I'm Melisa Idris, signing off for the evening. Thank you so much for watching, and good night.